I'm going to go ahead and start. It's already 7:01. Our webinar this month is actually very different. We've never done this before, so bear with me here. We thought, given the fact that this is National Hair Loss Awareness Month, that this would be a good opportunity to try something different. We have had monthly webinars and sometimes almost weekly webinars for a period of time during the shutdown of the pandemic, but we've gotten a lot of response and a lot of questions even afterwards. And so I'm going to just give you a quick rundown of a few facts, and then I'm going to open it up for discussion. There's a lot of people signed up for the webinar today, and I really do want to answer all of your questions, but if I run out of time and I don't get to them, what I would ask you to do is to send your question to our website. Well, actually the email, it's info@meditresse.com, and give that question there, and I will answer them individually. I'll get back to everybody. I just am concerned, given the numbers of people that have signed up for tonight, that I'm not going to get to everybody, and I really do want to answer all of your questions. So I really appreciate you joining me. Again, this is a new format for us. We've never just opened it up for questions. We've always had questions at the end of our topic discussions, but we've covered a lot of material over the last year and a half on our webinars, and there are always really great questions. I can honestly say there are some I don't necessarily have the answer to, but I do get back to people when I'm not sure. The good news about the treatment for hair loss is it's evolving, and new things are coming up all the time. So again, our website, we do try to keep people up to date, and with our monthly newsletter, we try to put information as well. So with all that being said, again, I just want to say, for the questions, I would appreciate people putting it in the Q&A icon and not the chat. The chat is more for, you guys can talk to each other if you choose to, but the Q&As that I'm going to answer will be in the Q&A section. So again, this is Ask Medi Tresse Anything or Ask Me Anything. I would say the little caveat to that. Okay. Okay, I think I was lost for a minute, but I'm back. I'm not the most technically savvy person around, so I'm glad I'm back. So again, I'm Dr. Mary Wendel. I am the medical director of Medi Tresse. We presently have 4 offices, 2 in Massachusetts, 1 in New York, and 1 in Tennessee. And I'm the medical director. So welcome. Briefly, I'm going to talk about the hair life cycle, risk factors to female hair loss, the types of hair loss, what constitutes a good medical evaluation, and then some treatment options. Okay, the hair life cycle, this seems kind of technical, but it actually is really important. The basis of all hair loss can be looked at in relationship to the hair life cycle. The anagen phase is the growth cycle, and that is the longest cycle. It is very long when we're little girls and our hair can grow down way past our waists. But unfortunately, with time, that growth cycle shortens. And as you age and pass menopause, the anagen cycle can be less than 2 years. There are certain things that can shorten it or lengthen it, including some treatments, which is a good thing, because with some hair loss, the cycle shortens even further, which is not to our advantage. The catagen phase is really the transition or the resting phase. And it really is just, again, the transition between the growth phase and then the telogen phase, which is when the hair prepares to fall out. Typically, the vast majority of our hairs are in an anagen or a growth phase. a certain percentage, 10% or less, are in the telogen phase. And each hair has its own different life cycle independent of all the hairs around it. Okay, what are your risk factors for hair loss? Genetics is probably one of the biggest ones. The greatest number of patients we see here have female pattern hair loss or androgenic alopecia, which has a genetic basis to it. Just because there's hair loss in your family doesn't necessarily mean you're going to have it, but most people that do have genetic hair thinning, there's people in their family they can point to and say, yes, it's there, both men and women. Stress, we know, can play a huge role in hair loss. We've known that, especially in the last 2 years. We've seen an incredible amount of women coming through the door with shedding, and it's related to a lot of the stress and some of the illness that we've seen with COVID. Poor nutrition is a huge part of our hair health, and if your nutrition isn't good, if you're not getting all the nutrients and the proteins that you need and the vitamins, your hair will not be healthy and is more likely to fall out and be brittle. Illness, any kind of illness can cause excessive shedding and poor hair growth. Included in that group is also surgery. Any kind of surgical procedure can cause excessive shedding, and nutritional deficiencies that can occur with illness can also contribute. Hormonal imbalances include not just the female hormones, which vary during our lifetime, but also hormones such as thyroid or cortisol or testosterone. We all are very familiar with the hair changes that take place during pregnancy. But again, as we approach and then pass through menopause, hair loss is more common. And that brings up the aging factor, which again, unfortunately, can accelerate underlying hair issues. Scalp and follicle health is very important. What we do to our hair, what we do to our scalp in terms of styling and curling and straightening and coloring and all of those things that we do, unfortunately, can affect our scalp health and our follicle health. And some skin issues as well, like psoriasis, lupus can affect the scalp health and unfortunately can also affect hair. So the two major groups of alopecia, which just means hair loss, is the non-scarring alopecia, which is the genetic or the female pattern hair loss, the telogen effluvium, which is excessive shedding. Traction alopecia is hair that's been pulled too tightly, and as a result, it can be permanently lost. Alopecia areata is most commonly circular thinning spots that can be seen fairly easily with the naked eye. Unfortunately, it can progress to more profound hair loss. We are seeing more post-cancer hair loss, and the good news is it's because more people are surviving their treatments and the survivability of cancers in general is improving. So we're seeing a lot of people whose hair just didn't recover from their treatment. And there are things that can be done to help that as well. Scarring alopecia is much more difficult to treat. It's occurring more frequently. It causes scarring of the hair follicle, and which can cause permanent loss, which is why the sooner you get treatment, the greater likelihood you're going to save some of those hair follicles and save the hair as well. So the medical evaluation for female hair loss, we stress this all the time. And the reason for that is there are so many different types of hair loss, and without the proper evaluation, you're not going to get the proper treatment. And we see people coming through the door who have seen quite a few other clinicians or even estheticians who have not fully evaluated the cause of their loss, and as a result, they don't get the treatment that they need. And a good evaluation includes a medical history, a physical medical history, the hair loss history, a good examination of the scalp. The trichoscopy is a magnification of the scalp and the hair follicle. And sometimes, depending on the age and the underlying issues, we do recommend blood work, and rarely do we recommend a biopsy, but sometimes we do. And the treatments for female hair loss, again, it's totally dependent on the underlying cause. And the treatment plan is different with each person and can include some of the following, but not necessarily all of them. Again, depends on what your underlying problem is. PRP, we have a variety of types of PRP, platelet-rich plasma, that we do. One is the optimal platelet concentration, in which we are able to actually find the correct amount of platelet concentration that gives you the best result in terms of growth. We also are now starting to utilize a painless PRP. It's a needle-free treatment. We do recommend low-level laser therapy in some instances, sometimes supplements, vitamins, minoxidil in almost everybody. There are other topical treatments that are being utilized now. Some newer ones are being investigated, which is good news. And then sometimes prescriptions are utilized in certain types of hair loss, whether they're oral or topical prescriptions. And hair transplants, there are some women who can benefit from a hair transplant. Not a lot, but there are some. And so we do evaluate women for that as well. Okay, that was our brief presentation. We're going to open this up to questions. Okay. Okay, I was going to try and make myself big on the screen, but I'm not sure let me see if I can do this. Nope. Okay. All right, so questions. Let me go to the question section. How much shedding is normal? This person said she feels like she's losing a lot of hair. The typical amount that you'll read is that up to 100 hairs a day is considered normal. That's a pretty high number for someone like myself who has fairly fine and thin hair. I would tell you that if you have a lot of hair, young people who have a lot of thick hair, up to 100 a day is not unusual, and that would be considered normal. If I had lost 100 hairs a day, I would think that would be excessive. But I would tell you up to 50 would be considered normal. If you're shedding more than 100 a day, no matter what kind of hair you have, that would be considered excessive. And the reasons for the shedding can be many, and it needs a thorough evaluation to determine what the best treatment is. The cause needs to be determined first. The next question is, somebody wanted me to discuss the painless PRP. And which an excellent question is the efficacy compared to the regular PRP or the optimal platelet concentration. Painless PRP is relatively new. PRP is not that new. We've been doing it for 6 years now. We started doing the optimal platelet concentration about 2 years ago. We did our own studies to determine that the best optimal results occur when you get a certain concentration of platelets within the PRP solution, and we are now able to determine that. Now, to do the optimal PRP, it does involve numbing the scalp, around the area of treatment, and then utilizing injections to get the solution into the areas that you want to treat. The painless PRP utilizes a system called jet peel, and it utilizes a high intensity velocity fluid. It's the PRP solution. It is the optimal PRP solution. So we have, again, determined the best concentration for that, but it utilizes this intense high-speed flow, which can actually penetrate the skin without a needle. And it gets down far enough into the skin layer to get around the hair follicle, which is where it needs to go. Now, we still do the same schedule of PRP, whether you do the painless or the optimal concentration. It's one treatment a month for 3 months. And then we wait about a total of 6 months to see what kind of response we're getting. Your question about efficacy is an excellent question. Is it as good? And the answer to that question is we believe that it is, but it is a newer treatment. There is a physician in New York who has been using it for a while, and he was so impressed with the results, he was so happy with the results that, in fact, he does not offer the PRP with the needle injections any longer. He felt that it was unnecessary because he was getting such good results with the painless treatment. I'm sorry, apparently I keep getting bumped. But I'm back. Okay. Sorry about that. If someone wants more information in regards to the painless PRP, you can contact the office. We'd be happy to speak to you directly about that. Next question is, someone's been using laser cap since February. The hair has become very dry. The question is, does the laser cap cause hair and scalp dryness? That's actually a great question. And I didn't know the answer to that myself until I started using it very regularly. And to be quite honest, I do think it causes a little bit of dryness. It's a cold laser, so it doesn't create heat like a hot light would, which you would think would make the scalp drier or the hair drier. It doesn't, I don't believe it makes the scalp drier. I do think it makes the hair a little drier. So, but because it is a cap that is enclosed and it does create a little bit of heat underneath it, I do think that it can cause a little bit of dryness. Now, my hair is dry to begin with, so I have to make a concerted effort to add moisture back into my hair. So I do think that if you're using the laser cap, which I do use faithfully, and I do believe in it, and if you think that your hair is becoming a little bit more dry, then be very conscientious about your conditioning. I don't shampoo every day, but I do condition almost every day, or I also will use our an oil treatment that we have, a serum. I do that once a week and I put it on at nighttime. And you'd be surprised how much of that oil gets absorbed into the strand of the hair. The first time I used an oil serum for the hair, you put a fair amount on and it does feel greasy. And I thought, you know, in the morning when I wake up, my hair is going to be incredibly greasy. Well, but in fact, it's not. The hair strands suck up that oil and it just reminds me of how much it needs that oil. Once the hair strand leaves your scalp, there's no blood supply to the strand of the hair. The more distant part of your hair strand has no blood supply. There's nothing you can get to it internally. So whatever moisture you need to add to it has to come externally. And so every time you shampoo, you should use a conditioner with it. And then in addition, you really should use some kind of conditioning treatment, whether it's an oil serum or a deep conditioning treatments, which we have here at Medi Tresse. There are also deep conditioning masks, which you can use. You just really need to put that conditioning and moisture back into the hair strand. In the summer months, if you spend a lot of time in the sun, that dries it up. And conversely, being in the winter when the heat is on, that dries our skin and hair. So yes, to answer your question, a long discussion about a very simple answer. Does the laser cap cause some dryness? I do think it does. I don't think it's excessive, but I do think it does cause a little bit of extra dryness to the strand, to the hair. But you can overcome that by adding it back. Okay. Treatments on the horizon. Those that are in experimental stages that have some potential, any future vision in the hair loss treatment world, a few months or a few years away. I do think that there's a lot of research going on. There was a fair amount of research going on with stem cells. The FDA has recently sort of put a yellow light to that. I'm not going to say a red light because they're requiring more research to be done. We do know that stem cells do stimulate hair to grow. And the most recent treatments of stem cells have had significant benefit, but more research needs to be done in terms of safety and certain protocols. I do think that will be coming back within the next couple of years. Right now, I put it on yellow. We can't do it right now, but we know that it's still going to take place in the near future. That's one thing, which is exciting. Secondly, there's some treatments for patients who have alopecia areata, which is the large areas of loss that occur. There are some new medications called JAK inhibitors, which have had significant promise in terms of reversing the hair loss. There are some studies being done on some of you may have heard of the medication Latisse, which is the medication that's used to grow eyelashes and eyebrows. There are some similar studies being done to see if a formulation can be made to put on the scalp topically. And the initial studies are very good in that they have seen good results. Again, it's a question of finding a formulation that's practical and reasonably priced. Right now, it's ridiculously priced, but the formulations have not yet been finalized. So there's research being done with the genetic part of hair loss, gene therapy. We're a long way away from that, but that's research that's being done as well. The good news is that the formulations of even the treatments that are being used today are being improved. There are better formulations of minoxidil. The laser caps are being improved continuously. So even the treatments and the PRP, which even since we've been doing it in the last 6 years, we've developed 2 different formulations that are better than the previous ones. So all of those things are improving on a regular basis, and a lot of research is being done. I will tell you, 10 years ago, when I first started looking into this topic, there was very little done for women. All of the research was being done on male pattern hair loss. Now there's a lot of research being done, including women, which is great. Because men and women, even though genetic hair loss may have somewhat of a similar basis for it, our bodies are very different. Our biochemistry is very different. Our hormones are very different. So the fact that the research is now being done means that in the next 5 years, we'll see better and improved treatments. Okay, somebody mentioned about the dryness from the laser cap. I will be contacting you specifically, and we can talk about things that we need to do to offset that, Kim. I'll give you a call. Not tonight, but I will give you a call. Okay. All right, comparison of the treatments like Formula PM and Vegemore hair serums. Yep, somebody said, when searching, one must be skeptical of results that display a description like the top 10 hair growth treatments for 2021. A lot of these best treatments are actually advertisements. So you're absolutely correct. You need to be skeptical of them. Now, I will talk to you a little bit about the difference between the Vegemore and the Formula PM, both of which I have some experience with. The Vegemore or Vegemore, depending on how you pronounce it, is a more natural-based hair, water-based solution that has some components which are found to be helpful for hair. What I cannot say to you, because I haven't seen studies, is I can't compare whether the Vegemore hair serum works as effectively as a minoxidil-based solution. There have been no comparative studies. I do know some women who like the Vegemore. They use it. It's considered more natural. It has supplements in it. It has plant-based things in it. So, it probably does have some benefit to it. I have a hard time believing that it works as well as the minoxidil does. The Formula PM and a lot of minoxidil solutions may leave more residue, and that can be a problem for some people, and I totally understand that. For someone like myself who tends to, I don't wash my hair with shampoo every day, but I do rinse it out. So I use a minoxidil-based Formula PM. It does leave more of a residue than a water-based serum does, but I know that it works. It has a lot of science behind it. It's had thousands of studies to show that it actually does increase hair counts and hair widths. Those type of studies have not been done on the Vegemore system. I do think it is a product that it's a nice product. I think that it certainly doesn't have anything that's going to harm you. I just don't know that it has the same benefit that a minoxidil-based product does. So for someone like myself, I rinse my hair out every morning using a Formula PM, which has a little bit more grease to it. It doesn't bother me in terms of leaving a residue. If I was someone who didn't rinse my hair out or shampoo every day, the Formula PM or other solutions like that might be more of a problem. But we have other solutions that we know have minoxidil in it, may not be quite as much of a residue left behind. So if you have specific questions in regards to that, we can hopefully help you with that. But you are totally correct when you say you need to be skeptical of the best top 10 hair growth treatments of 2021. Most of those articles are really advertisements, and it's like going on Yelp. Sometimes you wonder who's writing the reviews, because it's hard to know how much of it is real. So I can't compare the two solutions. We do know minoxidil has been around a long time. There are other formulations. If you don't like one particular one, we can certainly try and find one that works that has minoxidil in it. For people that don't want to use minoxidil, something like the Vegamore is a good option, but I don't believe that it works as well. Next question. What is the typical next course of treatment when you've used minoxidil for 9 months and don't see any success? Okay, that's the first part of that question. That's a really good question, because most people give up on minoxidil because you're not seeing the results. And that's unfortunate, because again, as I just mentioned, there are hundreds, if not thousands, of studies done on minoxidil. And minoxidil, certainly, I have patients who use minoxidil and come back to see me in a year, and the amount of growth they've gotten is remarkable and easily visible, and they're thrilled. And that's wonderful when I see that. Is that the majority of people? No. But what I can tell you is that what studies have shown is that almost 90% of people, and this is true of laser as well, almost 90% of people who are involved in this study, where they're doing microscope analysis, they're doing hair counts, they're doing hair widths, they're determining if the hair is healthier. There's no question that within 9 months, the hairs that you're experiencing after minoxidil treatment are better than they were. Now, that doesn't necessarily mean that when you look in the mirror, you're going to see a huge change. And that's why people give up on it. And that's the unfortunate part of it. So what I would tell you is, don't give up on the minoxidil. But if you're looking for more in terms of regrowth, then you need to consider taking the next step. It doesn't mean you give up on the minoxidil, it means you add to it. We do know through our own experience here, as well as studies that have been done, that treatments are additive. Just because one doesn't seem to get you where you need to go doesn't mean you give it up. It oftentimes means you need to add something to it. When I was in general medical practice, when I had patients with diabetes or hypertension, if one medication wasn't enough to get you where you needed to be, we often would add a second and sometimes a third. And that's because all of these treatments with hair loss work differently. They work at different levels of the hair follicle. They work differently biochemically. And so it's an additive effect. You stick with them and you add to them, you're going to get an additive effect. And so I would encourage you to not give up on the minoxidil, but if you're not seeing what you need, then you need to add to it. The second part of that question is, have you ever prescribed spironolactone? The answer to that question is yes. That is one of the medications that we sometimes do prescribe. I tend to prescribe it in women who are younger than 50, who are premenopausal, because it works on hormones. And as we approach and get through menopause, our hormone levels actually drop some. So spironolactone is not quite as effective. But in our younger women, and certainly, we see women as young as 15, sadly. But in our younger patients, spironolactone can be very helpful. Okay. Okay, it's kind of a long question, but I'll read it to you. Assuming one's life is fairly constant except for the aging process, in other words, there's nothing apparent that would contribute to the need for an additional method, can the aging process necessitate the need for additional treatment? And the answer to that question is yes. And I'll explain that in a second. If not, what would necessitate the need? Aging is a difficult process to fight. We have a lot of things that we can do to help, but we can't stop the process completely. And what happens with aging, a lot of it is biochemical, but some of it is nutritional. As we get older, we don't absorb our nutrients as well. That's a well-known fact. Our B vitamins don't get absorbed as well. That's why people develop B12 deficiencies and vitamin D deficiencies and other types of folate deficiencies, a lot of deficiencies that occur as we age. We don't absorb the nutrients as well as we age. So even separate from the aging piece, there are things that are occurring that make a difference. As we age, also, people that develop sort of like a borderline diabetes, their blood sugar isn't managed as well. All of those things play a role. The circulatory system takes a hit when we age. The blood supply going to the hair follicle diminishes. Minoxidil and laser both help improve the blood supply to the hair follicle, another benefit that I didn't mention before. And that's so important with aging, because the blood supply tends to diminish as we age. The last part of this question is a hard one. If aging is a factor, is there a concern that at some point the options for maintaining hair growth are exhausted? Well, the answer to that question is, people ask me all the time, well, how long do I treat this? And the answer is, you treat it as long as you care. And that sounds kind of maybe a little harsh, but in fact, I see patients in their 90s, and when they come through the door, I'm in awe of them, because these are women who still are living a very active, full life. They care about their parents. They don't want to lose any more hair. And so it makes a difference to them. And so doing as much as they can is still part of their plan. Now, that's not every 90-year-old. There's some 90-year-olds that don't care. And they may have cared when they were younger, but they don't care. But there are a lot of people, I'm pushing 70. I keep telling myself 70 is the new 50. So I still care. My mother was 90 when she passed away. A few months before she passed away, she turned to me and she said, Mary, my hair's thinning. What can I do about it? And I had to chuckle because she cared. But yet, interestingly enough, she was fairly fragile and didn't go out very much, but she still cared. And every time she looked in the mirror every morning, she said, my hair's thinning and I don't like it. But so treatments are improving all the time. Every month I see new studies coming that now involve women, which is wonderful. So, when you say, are the options exhausted? In my opinion, they don't get exhausted. If you care about your hair, you keep working at it, and new treatments are coming. And the way we are doing the treatments we're doing today are going to be better in 2 years from now. So everything gets better, and new treatments will come along. So aging is hard to battle. Aging is a tough one. And so, yes, if nothing else is changing and we can make sure that your nutrition is good and you're absorbing all your vitamins and nothing else is going on with you in terms of hormonal, your thyroid doesn't tend to work as well. A lot of things get in the way as you age. But again, it just means if you care, you just have to be diligent. And I have to work harder now than I did 10 years ago to maintain the hair that I have. I'm doing more than I did 10 years ago. So, and as new things come, I will probably move on to those as well. So it's not that you give up when you hit a certain age. You care enough, you keep going at it. Okay. How do we determine the best PRP concentration? Is it a higher concentration that's always better? Are platelets of older people less potent than the platelets of younger people? All great questions. We actually have a platelet counter here in the office, so we determine what your platelet count is. Research has demonstrated a specific concentration, a specific number that we try to approach that we know stimulates tissue to regenerate better. If you don't reach that concentration, the success rate goes down, which is why we realized that we needed to know what those platelet counts were and how best to determine to get to that concentration. So we are able to get to that concentration in every patient that we do the optimal platelet concentration treatment for. Are higher concentrations always better? More is not always better. And so there hasn't been as much research done on this, but some of the initial studies did show that you can get too high. More is not always better. So there is a range that we try to get to. And with our platelet counter and our methods that we utilize here, we are able to get to that optimal concentration that research has demonstrated works best for PRP. And here's the question about aging. Are platelets of older people less potent? There's no evidence to show that. We have not seen that at all. Somebody asked, do we recommend Minoxidil plus the cap? Absolutely. That's my routine on a I apologize, ladies. I have bad internet access where I'm at. It's a computer issue. So I apologize. The supplements we utilize, there are quite a few supplements on the market, Nutrafol, Viviscal. We have developed our own line, which actually pulls the best parts of all the supplements that we had found into our own line of supplements. Why do I think it helps? It's really an interesting question because when I was in general medical practice, I didn't actually recommend a lot of supplements except in patients that were nutritionally deficient or had been ill for quite a long time. But as I've come to realize is, particularly with aging and stress, we don't absorb our nutrients as well. And we don't get enough vitamin D from the sun. We don't get enough there's no vitamin D in much of our food unless it's supplemented. A lot of our nutrients, a lot of the foods that we eat in this country are nutrient deficient. This country has the worst diet on the planet. And a lot of what we eat is pre-processed and has very little nutritional value. It may look great, but it doesn't provide a lot of nutrition. And because of this, I have changed what I believe. I think most of us need some nutritional support. Now, the line that we have here, we actually have broken it down into two parts so that we can really individualize the supplements that we recommend. And so I myself don't eat meat. I'm a vegetarian, so I utilize the portion of our nutrients that give me an extra amount of the B vitamins that are required. But again, I do think that nutrients are important. The other thing that has changed is we now understand the importance of our gut health. Probiotics, we know, are very important for the absorption of all these nutrients. And again, our diet in this country has pretty much stripped away a lot of the nutritional benefits that our gut works so hard to provide. And so one of the other things that we do provide here as part of our line of nutrients is a probiotic or a prebiotic, which helps the probiotics work better. So if you'd like more information about that, we would be happy to send that out to you. I'll make note of that. But if you want to get more information, if you call the office, we can get that out to you, or email us and we'll send you more information. Somebody asked, they see topical products with more than 5% minoxidil. Do you think those are safe to use? Yeah, I do think they're safe. The interesting part is there aren't a lot of studies comparing 10%, to 5% minoxidil. Once in a while, I will recommend a 10% minoxidil product. The problem is that, again, it tends to be a little bit greasier and generally comes in a spray form, which can rest on the hair strands a little bit more. But in most cases, it's not necessary. All the studies that have been done on minoxidil were done on 5% once a day. So again, there are some with 10% or more, but excuse me, I don't think that it's really necessary. They are safe. There are very few people that actually have a bad side effect reaction to minoxidil. It's very rare to have a true side effect reaction. The most common side effects to minoxidil are a local reaction due to just irritation of the scalp. Do I encourage the use of topical biotin treatments? Biotin is a really hot topic that I actually like to talk about. There's a little bit of research to show that biotin does help, but there's not a lot of research. But biotin's around for a long time, and the fact that it seems to help some has resulted in it being in pretty much all of the hair growth supplements and treatments. Topical biotin, there are some topical treatments that include biotin. You can get biotin in addition to minoxidil combined. You can have minoxidil combined with tretinoin, which actually allows the minoxidil to be absorbed better, which is what is in our formula PM. So a lot of things can be added to the minoxidil, or you can use the biotin alone. It's not going to work as well as minoxidil is. If it's added to the minoxidil, I'd say it's fine. But again, there's not a whole lot of research on biotin, despite the fact that it's in everything. But the few studies that I've seen do show that it seems to have some benefit. Do we need to put sunscreen in the scalp, and what types of sunscreens are appropriate, as I have sensitive scalp? I love this question. Thank you so much for asking it. I did a whole webinar on sun and hair, and this is a really hot topic. So if you have really thin hair, and I see that here, and your scalp is, it's interesting because the skin on the scalp and the head is much thinner than your skin on the rest of your body, particularly your hands, your feet. The scalp is so thin and so fragile and so sensitive to the sun and sensitive to chemical as well. So if you have fine hair and you're not wearing a hat, you really should put sunscreen on your scalp. I personally would encourage you to put a hat on. That's what I do. But in lieu of that, yes, I do recommend sunscreen. The skin is very sensitive. I see skin cancers all the time here on the scalp. And when I was in general practice, skin cancers on the scalp are very common. So sunscreens are important. The reason this topic is so interesting is because there are certain sunscreens that may be causing some problems in terms of hair loss. You may not remember, but I discussed the scarring alopecias. There is some evidence that some of the products that we use that are in sunscreens may in fact aggravate the scarring alopecia. So my recommendation is, yes, to use sunscreens if you're not wearing a hat. And if you're going to use a sunscreen, the only one that I would recommend, the only one, and I put that in big letters and underline it, the only one that I would recommend is a zinc product. There's been no evidence to show that the zinc products cause any kind of problem with the hair. So they tend to be kind of thick. There is Neutrogena actually makes a thinner zinc-only sunscreen for this face, which I do recommend. But if needed to use on the scalp, I would put it on the scalp as well. But you may just want to wear a hat, honestly. Sunburn on the scalp is very painful. The skin is very fragile and very sensitive. The chemical sunscreens have an incredible amount of chemicals in them. I don't recommend them for the scalp, just the zinc. Question about Medi Tresse vitamins. That's a great question. We actually are going to do a study. We're getting that information together now. So to answer your question is yes, we are going to be looking at that. Hopefully similar to what Nutrafol has published, but it takes a while to do those kinds of studies. It takes a while to set them up and it takes a while to get the information. But we are just embarking on that now. So thank you for bringing that up. Patient asks, is there any hope for insurance coverage for treatments? Boy, this is a hard one. We see patients who have gone through cancer treatments. I'm taking care of a 16-year-old girl now who went through cancer treatments, and she lost most of her hair and not much of it grew back. And insurance won't cover any of it. And it's sad. And they now, insurance will cover corrective surgery for a lot of different procedures, but they don't cover this. And is there any hope of that happening in the future? I doubt it. If anything, insurance companies are getting more restrictive, not less. The only thing that I would say, if you have one of the flexible spending accounts, the FSA accounts, as part of your insurance benefits, some of our patients do use those and it will get covered for that. But in terms of actual insurance covering treatment for hair loss, I don't see that happening anytime. The only caveat to that is that, again, it's interesting what they decide to cover and not. Insurance will cover some treatments for scarring alopecias. They will cover any kind of prescription medications that we prescribe, regardless of the cause of hair loss. They do cover the prescriptions. They will cover the prescriptions and some of the treatments for alopecia areata, but they don't cover PRP treatments. They will not cover laser caps. Sometimes the minoxidil gets covered. It's extremely variable and really really bothers me a great deal. We've tried, particularly for some of the cancer patients, to get their treatments covered and have had limited success. So anyway, wishful thinking, and we'll keep hoping. A woman does state that she finds that minoxidil does build up when she doesn't wash her hair every day. Did you mention rinsing, not washing your hair daily? Yes, that's actually what I do. I actually only use shampoo twice a week, but I do rinse it out. And that does take away the buildup of the minoxidil. So that is one solution. That's something that I do. And the reason I do that is the minoxidil that I use has added ingredients. It's a formula PM. It has the added ingredients like tretinoin, which does aid in the absorption of the minoxidil. It also has some anti-inflammatories in it to help decrease any potential inflammation, but it does leave a bit of a residue. And so I do feel the need. I rinse it out at least every other day, sometimes every day, depending on my activity. So that's fine. You can do that. If using mouth minoxidil and laser cap causes the scalp to get itchy, what does it mean? Which one should you keep? Honestly, what you need to do is have it looked at, because there are a lot of things that can make your scalp itch besides just dryness. For me, I use minoxidil and laser cap. My scalp is a bit dry, but it was dry long before I started using any of those treatments. I have very dry skin. So I tend to have a little bit of psoriasis. I can have a little bit of seborrhea. That has nothing to do with the minoxidil or the laser. So those require a different kind of treatment, a different kind of shampoo treatment altogether. So what I would tell you is don't give up on either one, except and to have your scalp looked at. Now, having said that, we do know that minoxidil over the counter has a lot of alcohol in it and can be irritating. So if you want to stop that for just a month or so, continue to use a laser cap and see if the itchiness goes away, then you know it's the minoxidil. The minoxidil is much more likely to cause your scalp to be itchy. Laser cap doesn't usually cause the scalp to be itchy. It just can cause the hair to be a little bit drier. So I think if you're really having a lot of itchiness, hold off on the minoxidil for a little while and see if it gets better. But regardless, I still think you should get your scalp looked at, because you could have something else going on, whether it's a little psoriasis, a little seborrhea, which requires a totally different treatment. Question, outside of thyroid hormones, what other blood work should be checked that may be affecting hair loss? In particular, she's perimenopausal. Well, that's an interesting age, because you're right on the edge. What we generally do, we do check thyroid hormone levels. I will check in all my premenopausal patients. I do check testosterone and estrogen levels. When you're perimenopausal, I think it's probably worth checking it anyway. Even though the levels do drop during menopause, it's nice to know what kind of ratio of testosterone to estrogen you have. If the testosterone is too high, as your estrogen drops, it's more likely to affect your hair. We also check a blood count, iron levels. Low iron levels are very common in women as they approach menopause. You've had almost 40 years of monthly periods, and even if your bleeding isn't excessive, that's a long time. And generally the iron, you can lose iron in your body, and that can affect your hair. So a blood count, a ferritin level, which is an iron. We do check vitamin D levels, because in this part of the country, nobody gets enough sunlight, and our vitamin D levels can be low, and usually are, and can affect your hair growth. I also check the vitamin B12 and folate, because again, those are B vitamins that can affect hair health, and they tend to decrease in absorption as we age. So that's pretty much, again, I do check thyroid. We do check a ferritin, a CBC, which is a blood count, testosterone, estradiol levels, vitamin D, and vitamin B12 and folate is the minimum. Again, depending on if you're having specific symptoms that may push me in a different direction, I may do other ones as well. But those are the basic ones that we do pretty much all the time. Okay. Can you purchase Minoxidil online, or does it have to be the Medi Tresse brand? The Minoxidil that we use actually is not a Medi Tresse brand. The Formula PM is formulated by somebody else. We do sell it though here. I don't know if you can get it online. You can, there are a lot of different kinds of minoxidil. You have to read the ingredients to know what you're getting. I'm going to call you, Kim, because you have had a lot of questions, and I really want to reach out to you so we can answer all your questions specifically directed to you. So I will get in touch with you. Okay. Question. Does wearing a hat contribute to hair loss? No, no, that's actually a myth. And somebody said to me, well, cowboys all wear hats all the time and they're all losing their hair. Well, you know, up to 70% of men lose their hair. So 70% of cowboys are going to lose their hair. So no, there's no evidence that wearing a hat contributes to hair loss at all. None. But I love the question. It's true for women as well as men. Does massaging the scalp with essential oils help with increasing blood flow to the scalp? And do essential oils clog follicles? Good question. There's the good and the bad. Okay. Massaging the scalp with essential oils. Massaging the scalp does help bring blood flow to the scalp, whether you're putting oils in or not, just the act of massaging. And now, is it going to make a huge difference in terms of hair growth? Probably not, but that's probably what brushing did when women in years gone by had long hair and everybody brushed their hair 100 times each night and it made their hair healthier. It probably helped bring the blood flow, and it did help clean out the hair follicles by brushing aggressively. So there is some benefit to that. Having said that, the next part of this question is, do essential oils clog follicles? Yes, they do, which is why I don't recommend oiling your hair every day. I put oil once a week. And again, my oil treatment is directed to the hair strand and not so much the follicle. I do have dry scalp, and I know that some of the oil will get to my scalp, and that's important. But you can overdo a good thing. And this is one of those places where you can. If you have very dry hair and you want to oil it more, I would say, massage the scalp with oil maybe once a week. But the other times, if you want to add some oil to it, you can put it just more towards the ends of the hair. Because we do see, it's interesting and it's really sad. And it always breaks my heart when I see women come in who are afraid to wash their hair because they hate seeing it come out when they wash. And in truth, washing doesn't make your hair fall out. It just makes it visible. And so it's important to shampoo fairly regularly. And again, it depends on the type of hair that you have. If you have oily hair, you may need to shampoo a little bit more. If you have dry hair, you probably need to shampoo less. But women who are afraid to shampoo will come in and their scalp is very unhealthy. It's very inflamed and dry, and the pores are plugged with oil. Our scalp does make oil of its own. It makes less as we age. That's true of all of our skin. But the normal sebum does help lubricate the scalp and the hair. But if you don't rinse it away once in a while, it does build up and it clogs the pores. Somebody said they heard that Johnson & Johnson sulfate-free shampoo has been sued for harmful chemicals. Worth mentioning. That's really, yeah, that's a great question. I don't know about their particular brand. Sulfate-free is another hot topic, and I'm going to address that. And we talk about this in the hair loss conferences. They discuss what is the deal with sulfate? Is it damaging to the hair? The issue is that there's a lot of chemicals that may be harmful to certain individuals, not to everybody, but there's some people that are very sulfa sensitive. And so sulfate-free shampoos may be better for them. Some people who tend to have greasier hair that builds up oil more, aware of any particular shampoo that actually causes specific damage to hair. I'm not familiar with the Johnson & Johnson sulfate-free shampoo issue. I haven't seen that before. What I always tell people is shampoos have a lot of chemicals in them. And I've always wondered why there's so many. I did go to a meeting where actually, I think it was one of the scientists who worked for Johnson & Johnson, talked about all the different things that are in the shampoos and why they're there. The sulfa is there to help cleanse the scalp, to relieve the scalp of some of the debris and the excess oils. Doesn't mean you need to use a sulfate shampoo. It doesn't mean that, but that's why it's there. You can alleviate some of you can get some of the cleanliness and alleviate some of that debris without a sulfate shampoo. So again, it's a sensitivity issue. I'm not familiar with the lawsuit. We actually have sulfate-free shampoos here because, again, we do know that a lot of people are sensitive, and so we need to be respectful of that. Next question. Do you think finasteride pills are safe, or do you recommend the lotion? First of all, I don't recommend finasteride in anybody who's premenopausal. So I'm going to answer this question for anybody who's postmenopausal. They are not safe in premenopausal situations. But postmenopausally, finasteride pills are actually safe unless you have a history of breast cancer. Finasteride can stimulate a little bit of breast tissue growth in men. It hasn't necessarily been shown to be that way in women, but because it does happen in men, they get enlargement of their breast. We've been told to keep it away from women with a history or a strong family history of breast cancer. Now, having said that, anything put on topically in the lotion is going to be safer than anything you take orally. So, but again, the issue often comes to how many things are you putting on your scalp? And how well do you tolerate all the things that you're putting on your scalp? So you can get finasteride plus minoxidil. We do have a few patients who are using it as a topical solution. And so I do believe that anything put on topically is probably safer than anything taken orally. Very little of it gets absorbed. It's not zero, but very little bit does get absorbed. Blow drying your hair, does that hurt your hair? It dries it out. It makes it more brittle, makes it break off. It takes the shine away. You just have to offset it with a lot of conditioning. I'm such a pusher of conditioning and oil serums to put that moisture back in your hair. I blow dry my hair more than I should, but again, I have to put that moisture back in, and I work really hard to do that. Is the generic brand of minoxidil okay? Yeah, it's just yes. But the brand name Rogaine is no better than the generic. They would argue that it is, but I would tell you that it's not. Is volumizing mousse harmful? Absolutely not. I use it every day. Minoxidil is a vasodilator. Is this its main effectiveness, or there's something else that it does? Is alcohol a vasodilator as well? Would alcohol work as well as minoxidil? Okay, let's break this down. Minoxidil is a vasodilator. It is one of the reasons that it works. It brings the blood flow back to the hair follicle. It does allow better blood flow. It's not the only way it works, though. The more recent research in the last few years have really shown a lot of biochemical reactions that take place at a very microscopic level that is probably a bigger reason why minoxidil works. It does vasodilate, and that's a good thing. Blood flow to the head to the scalp and to the hair follicle is a very good thing. But it's only one of the reasons that it works. It does have alcohol in it. Most minoxidil solutions have alcohol in it. Not all of them. We try to avoid it as much as possible. The over-the-counter generic and brand name Rogaine/minoxidil has alcohol in it. Alcohol is not a vasodilator, and it doesn't work as that. Unfortunately, alcohol can dry the scalp out more, and it's one of the biggest reasons why people are sensitive to minoxidil, myself included, which is why I can't use over-the-counter. It just dried my scalp out too much. Do no lather shampoos clog follicles and cause hair loss? I know there was there have been, I did read the Wen product was involved in a lawsuit. You need some lather. You need to clear out some of the debris, the cellular debris, and some of the oil that's on your scalp. At least once in a while, you need to use some kind of shampoo that has a lather ingredient in it. For myself, I tend to use a sulfate-free. most of the time, but once in a while, what I do notice is that I do need to use something that has a lather shampoo to just do a little bit of sort of a clarifying shampoo is what I would call it. Because all of the stuff that I put on my hair, all the products that I use to make it look fuller, the minoxidil, all of the things that I do build up on the hair strand. And so these no lather shampoos are not able to remove these products as well. So I will tell you that every so often, every few weeks, I do use a clarifying lather shampoo to free myself of those things. So I don't know that they cause hair loss, but what they do is they don't cleanse the scalp as well. That's really the problem. So I know the Wen products were involved in the lawsuit. I don't know anything about the Diva Curl ones, but probably like the Johnson & Johnson one. I don't know that lawsuits, I don't know about the lawsuits, but they don't cause hair loss as far as I know. Okay, I'm going to let you ladies know. I think I have only one more that I need to do, which is perfect timing because it's 8:02. Somebody asked, is it okay to use a laser cap every day? Wonderful question. Thank you. This is another one of those categories where more is not better. There has been some research recently done to suggest that you use it exactly the way it's prescribed and not more. And the fact that more can result in resistance to the laser as being beneficial. So please do not use it every day. Use it only as prescribed. And believe it or not, I think that's the last question. So it's perfect timing. Kimberly and Denise, I'm going to try and reach out to you personally and answer some of your questions, not tonight, but over the next week. Anybody else that has questions that weren't able to have them answered, please email us at info@meditresse.com or go to our website or call us anytime, and we would be happy to reach out to you to answer any of your questions. Thank you, ladies, so much for joining us. This was a new format for me. We probably won't do it again for a little while, but obviously there's enough interest that we should do it every few months or so. So the other thing I want to hear from all of you is that if you found this helpful or not, and if there are other topics you'd like us to discuss. We've talked about everything that we can think of very recently, but we always are looking for new things, and we will always come back around and discuss the things that we've talked about before to reach out to new people that we haven't met. So please, thank you so much for joining me tonight. I actually enjoyed this a great deal. This is the end of National Hair Loss Awareness Month, but we're going to keep pushing for make hair loss awareness as much as possible. It's a very emotional topic for many of us, and a lot of women are still afraid to come forward. Please encourage your friends and family members to reach out. There's a lot that we have to offer. There are new treatments coming all the time, and we want to one of our slogans is normalize female hair loss, and that's because we want it to be, not that we accept it, we don't accept it, I won't accept it, but we will normalize the discussion. And that's what we want to do. We want to normalize the discussion. We want women to feel safe and comfortable to say, hey, you know, what can I do about this? What really works? What doesn't work? What am I wasting my money on? Because I know we've all wasted a lot of money on products that don't work. So thank you so much for coming, ladies. I appreciate it. And keep us updated on your interests. And if you have any further questions, just reach out. Thank you so much. Take care. Stay safe.